There was a 4-day crossover in managed isolation between a returnee with the more infectious South African strain of COVID and the Northland woman they passed the virus to. Genome testing indicates it was a direct transmission, but exactly how the virus spread between the two is a mystery right now. The carrier returned a positive day 3 test, but Doctor Ashley Bloomfield says that person was free to move around the Pullman Hotel before they got the result.
They don't have to stay in their room while awaiting a day 3 test, but of course their movements are very, very carefully and strictly regulated, and that includes only being taken out for exercise breaks and so on, with strict infection prevention protocols.
Where would that have day 3 test, where would it have taken place? In their room or somewhere else?
Yes, in their room. So the nurses go along and when they do their daily check-ins with people and or if they're doing a swab, then it happens essentially at the door of the room.
So there's only basically 4 days where these two people were in the Pullman MIQ together, right?
Yes.
So when that person was moved to Jet Park, that is the day the Northland woman leaves the facility. Was there any contact that you're aware of during that transfer process, the person leaving for Jet Park and this woman checking out as such?
Look, there's nothing to suggest at the moment that they had direct contact. It's possible. We do know that our Northland case only left her room ready to do the exercise each day, some physical activity. She was very strict on sort of infection prevention control, wearing a mask when she was outside her room, which everybody has to do. So it could have been direct contact between the two, even fleetingly, and that's what we're looking at. Or it could have been a common surface that they touched, so-called fomite transmission, or some sort of aerosolization in the air and potentially even through the ventilation system. So all of those are things we will be looking at.
Are you seriously considering the ventilation system? Because I'm wondering if that was a possibility for infection, wouldn't you have had other cases like this transmitted in this way?
Yes, exactly. We would have expected that, and we haven't. But of course, it's a matter of looking at every single potential route of transmission. And so we can do a review of the ventilation system there at Pullman. We're in the process of doing that anyway for all the facilities. Again, this is just part of continually strengthening our response.
But would you accept that that is an unlikely route of infection?
It's unlikely but possible, and so we need to rule it out.
How far through the CCTV are you at this point? And does the Pullman have CCTV everywhere you need to see?
My understanding is the Pullman only has CCTV in the common areas rather than on corridors per se. So the CCTV footage may not tell us anything in itself, but of course interviews with the two people are important, interviews with staff, as well as the other work we're going to do looking at whether there were potential common surfaces.
Are we getting to the point where people should just have to stay in their room the entire time of managed isolation like they do in Australia?
Look, it's something that people raise from time to time. We think that the risk of allowing people out for specific purposes, it's not like people have the free run on coming and going as they like, with very good controls and strictly supervised. And I have observed this myself, just how this happens in a facility. It's very, very rigorously overseen. So we think that those risks can be managed at this point. We don't think there's a need to confine people to their rooms for the whole period. We have introduced that for that first test, the day 01 test, and people won't be allowed out of their rooms until that has returned negative.
So when you look at this, with the information that you've got, do you think it indicates an unforeseen hole in your protocols, a systems failure, or do you think it's some kind of fluke or rogue event that this woman has become infected?
Look, whatever one of the above it is, and I don't think it's by any means a systems failure. I think 102,000 people have now been through managed isolation, and we've got a really good track record of keeping them safe. So whatever it is, we will be looking meticulously at whether there is a gap and how we can close any gap if there is one, and keep strengthening our protocols, in particular around those last few days when people are there. Whether there's anything we need to do to prevent people who are clearly not infected with COVID from potentially being infected by others.
Given you are yet to work out exactly how this happened, is it time to go into some kind of lockdown, even if localised in Northland?
No, not at this point in time. There's nothing to suggest that there is any onward transmission at this point in Northland. and having identified...
But you're still waiting on tests though, aren't you, Dr Bloomfield? You asked all of these people to go in and have tests. You haven't got the results back. So we're kind of in that period of time where we don't know either way. So why not exercise extreme caution and lock down Northland just for 48 hours until you work it all out?
Look, I think we're already exercising much more caution than we have in the past, in the sense we're asking everybody who was at any of those 30 venues at the same time to get tested, and many of them will have had no obvious contact with the person. The second thing is we know from the results of the testing of the Northland case's two closest contacts, one, her partner she spent a lot of time with over that period of time, he's returned a negative test. And so that's, reassuring.
But they're not through the full incubation period, are they? So will they be retested, the hairdresser and the partner?
The medical officer of health will determine that. The normal protocol is that they spend the full 14-day period from when they were first exposed through to when the end of that 14-day period is, with testing twice during that period. The
point there is they're not out of the woods completely yet. While you say that is a promising sign, it's not a definitive result as such.
Oh, look, it's a very promising, given when these people were exposed in the first instance and the amount of time that they spent with the person, the fact they've returned negative results now is really very reassuring. So you don't think there's any need to lock down or place any restrictions on travel at the moment? Because the other thing is, there's a lot of people, it's summer, a lot of people travelling, there'll be Aucklanders up there, people from other parts of the country. Should they stay put until they find out what the deal is here, or should they return to their home cities? Look, the people who we think may be at some risk, even if it's small, are the people who were at the same venues our case was at the same time, and other people we're asking to be tested. At this point in time, we don't think there's any indication for us to restrict movement.
So in terms of that testing, obviously you've stood up extra testing facilities. As you'll be aware, there are some people who have been queuing for hours, and our reporters on the ground say some people are just turning tail and leaving without being tested because the wait has been too long. Is that good enough?
Look, I just want to reiterate the point we made in the stand-up today, and that is the priority for testing is anyone who's symptomatic and the people who were at one of the 30 venues at the same time as the case. Other people who are not symptomatic, who may just be concerned, don't need to be tested at the moment. For those who are waiting to be tested, thank you for your patience, and you can imagine the teams are working as fast as they can, and there is there are a number of facilities that have been stood up today to try and get everybody who needs to be tested quickly. So are there people in those queues that don't need to be in the queues to get tested? Is that what you're saying? Yeah, certainly there was a report from Northland today that there were people there who weren't symptomatic or who weren't at the venues, and they're not people who need a test today. What can you tell us about how this woman is at the moment? I mean, how did she take the news that she has this South African variant of the virus? Look, my understanding, and I asked this question specifically this morning, is that she's doing well and she's in good spirits. And, again, I think, as we've said, we can all be extremely grateful for the actions she has taken, because it's going to help us protect the community. And on that note, you haven't had any news of more positive tests? Not at this point, and of course we would be telling everybody as soon as possible if we did. And that, of course, is the very familiar voice of Dr. Ashley Bloomfield.